now. Okay, so as I mentioned, this is Reducing Lead in Drinking Water in Schools and Child Care Facilities webinar featuring New York Department of Health. This is a part of EPA's quarterly webinar series featuring different school and child care facilities lead in drinking water reduction efforts happening across the country. We were able to host Denver Water and Denver Public Schools in June, and are very happy to have New York Department of Health here to talk about all the wonderful things happening in New York in regards to schools and lead in drinking water. But before I pass it over to New York Department of Health and Kim Evans, who's going to be here to talk to us today, I am going to go through just a few background slides to give us all some context, and some of this may be a review, but if not, may be helpful just to set the scene and give us some information regarding lead and lead in drinking water. Okay, so lead is a toxic metal. It affects multiple body systems, particularly the nervous system. There is no known safe blood lead level, and children are most vulnerable to lead exposure because of their developing brains and nervous system, and toddlers' frequent hand-to-mouth activities increase their potential to ingest lead. Most of the dysfunctions produced by the absorption of lead are due to lead's ability to mimic and inhibit the actions of calcium. What is not excreted is absorbed into the bones where it can collect for a lifetime. Lead stored in bone may be remobilized into the blood during pregnancy, thus exposing the fetus, and undernourished children are more susceptible to lead because their bodies absorb more lead than other nutrients such as calcium, especially when that's lacking. So again, there's no safe level, no known safe blood lead level. And even low levels of lead in blood may affect a children's ability to pay attention, their behavior, and development. Most children with elevated blood lead levels do not exhibit any symptoms. However, effects may appear later in age. Other health effects may include kidney damage, anemia, and reduction in birth weight. Symptoms of severely elevated blood lead level, aka lead poisoning, may include stomach aches, vomiting, poor appetite, and nausea. The effects of lead exposure cannot be corrected. The most important steps parents, doctors, and others can take is to prevent lead exposure before it occurs. According to the CDC, there are approximately 500,000 U.S. children ages 1 to 5 with blood lead levels above 5 micrograms per deciliter. This is the reference level which CDC identifies as a child as having elevated blood lead levels, and screening, again with the prevention, is important both to ensure that poisoned children are identified and to generate data to target primary prevention activities. Lead is distributed in the environment through natural and man-made means. Today, the greatest contribution of lead to the environment stems from past activities, and we are exposed to lead from different sources, some of those on your screen, like paint, solder, and consumer products, and through different pathways such as air, food, dust, soil, and of course water. The primary source of exposure to children is lead-based paints used inside or on houses built before 1978. However, it is estimated that 20% or more of human exposure to lead may come from lead in drinking water. Children in schools and child care facilities may be exposed through water they drink or food that has been prepared with contaminated water. Formula-fed infants can receive up to 60% of their exposure from lead in drinking water. Lead in drinking water has no taste, scent, or color, and boiling water will not get rid of lead. Lead can get into drinking water by being present in the source water, for example, being contaminated from runoff or water pollution. However, typically treatment plant technologies can remove lead from these sources. Most lead gets into drinking water after the water leaves the local well or treatment plant and comes in contact with plumbing materials containing lead. These include lead pipe, lead solder, as well as faucets, valves, and other components made of brass. physical-chemical reaction that occurs between the water and the plumbing is referred to as corrosion, and the extent to which corrosion control contributes to the amount of lead that can be released into drinking water varies. And this slide lists a few factors that can affect the amount of lead that leaches into water. Soft, corrosive, or acidic, low pH water is more likely to cause leaching. Another key factor is water left standing in pipes over a long period of time can also increase leaching. So the longer water stands in the pipes, the greater the possibility of lead being dissolved into the water. And this can put facilities with intermittent water use patterns, such as schools, at risk for elevated lead concentrations. All right, on this slide, we're just talking about the different ways from a federal standpoint that lead in drinking water is regulated. First one you should see is the Safe Drinking Water Act lead ban of 1986, which is a requirement that only lead-free materials be used in the new plumbing and in plumbing repairs. And then the CIDWA Reduction of Lead in Drinking Water Act of 2011 further reduces lead in pipe fittings, plumbing fittings, and fixtures to a weighted average of 0.25%. It also redefines lead-free under the Safe Drinking Water Act to mean not containing more than 0.2% of lead when used with respect to solder and flux, and not more than a weighted average of that 0.25% lead when used with respect to the wetted surfaces of pipe fittings, plumbing fittings, and fixtures. There's also the Lead Contamination Control Act of 1988, and the LCCA is aimed at identification and reduction of lead in drinking water at schools and child care facilities. However, the implementation and enforcement of the LCCA has been at each state's discretion. And then, of course, we have the Lead and Copper Rule of 1991, which has been modified and revised. The lead is regulated via public water systems under this federal law. This law was initially passed in 1991 and requires systems to test for lead and copper and conduct actions that reduce corrosivity and protect public health. Okay, over the next two slides, I'm just going to briefly touch on water coming from the treatment plant and water as it comes in contact with the schools. So most schools and child care centers receive their drinking water from a public water supplier. However, there are some schools that have their own on-site water systems, such as a well, and therefore are considered a public water system. And as we mentioned on the last slide, public water systems are required to regularly test the water to ensure that it meets federal and state drinking water standards, and a portion of those are required to test for lead and copper. If the public water supplier finds unacceptable levels of lead at consumers' homes, the system may have to provide centralized treatment to minimize the corrosion of lead into water. The critical issue in this situation is even though the public water supplier may deliver water that meets all federal and state public health standards for lead, schools end up with too much lead in their drinking water because of the plumbing within their facility. So this illustration is showing the water coming from the public water supplier, and this one is it coming in contact with the school's plumbing. As water moves through a school's plumbing, lead can leach into the drinking water from plumbing materials and fixtures that contain lead, and testing is the best way for schools to know if there are elevated lead levels in their drinking water. EPA has developed guidance to assist schools and child care facilities in their efforts to reduce lead in drinking water. And one of these is called the 3 T's for reducing lead in drinking water in schools. The website that is listed on your screen and that will be in the slides that you all received after the webinar will take you to a page that has the 3 T's guidance manual as well as other helpful resources within the toolkit, along with 2 newer documents which are best management practices for schools and talks about other drinking water contamination and helpful practices like flushing and removing and cleaning aerators. All right, so that's just a brief background on lead and lead in drinking water and drinking water in schools. So now I'm happy to turn it over to Kim Evans, but before I do, I just want to give you a little background on Kim. Kim is a public health specialist who works in the compliance section of the Bureau of Water Supply Protection at the New York State Department of Health. Kim is a rule manager serving as the liaison between the State Health Department, EPA, and public water systems to ensure proper implementation of and compliance with several federal and state drinking water regulations, including the lead and copper rule. Ms. Evans has worked closely with EPA Region 2 staff over the past 10 years, assisting with the implementation of the voluntary 3 Ts for reducing lead in schools drinking water program at several New York State school districts. Ms. Evans was part of the technical team that developed the New York State lead testing in school drinking water regulation that requires all public school districts and boards of cooperative educational services to test all potable water outlets for lead contamination and to take responsive actions when required. This regulation went into effect on September 6, 2016, and Ms. Evans continues to assist with the implementation of the regulation through through outreach to local health departments and school districts. So I'm going to go ahead and turn it over to Kim. Give us 1 second to switch our screens. All right, Kim, I can see your screen fine.
Okay, very good. Thank you, Victoria. Good day, everyone. My name is Kim Evans. I'm joined here today with some of my fellow colleagues from our school lead team. We welcome you to this presentation, and we are happy to share our knowledge and experiences with you on developing and implementing a lead testing in school drinking water program. We hope you find this presentation insightful should your school or agency be developing or considering to develop a similar program in the near future. So without further ado, I'll now give you a brief overview of New York's school lead testing program. Just a little over a year ago, on September 6, 2016, Governor Cuomo signed landmark legislation mandating that all public school districts and boards of cooperative educational services, or BOCES, in New York State to test their tap water for lead contamination and take responsive actions as needed. To implement this new law, the New York State Department of Health, in consultation with the New York State Education Department, issued emergency regulations under Title 10 of the New York Code of Rules and Regulations in Subpart 67-4. The State Health Department serves as the regulatory and technical arm of the regulation, and through the New York State Education Department, the state will reimburse schools for a large portion of their testing and remediation expenses through New York State Education Department funding. Subpart 67-4, as we said before, applies to all New York State public schools and BOCES, including those classified as a public water system. And this means if a school has its own on-site water system, they are therefore required to test their drinking water under the federal lead and copper rule. The lead and copper rule requires periodic testing for lead and copper throughout the distribution system of the public water system. Therefore, if a school has its own on-site water supply and is already conducting lead and copper testing under the lead and copper rule, they now must also conduct lead testing as specified in the lead testing in school drinking water program. Sampling completed under one program does not satisfy the requirements of the other. They are two separate and distinct regulations. There are significant differences in the sampling and testing requirements between the lead and copper rule and New York school lead testing regulation. And it should be noted that New York's program also differs slightly from EPA's 3 Ts program. This regulation does not apply to non-public or private schools or charter schools or daycares. However, we do encourage those schools to voluntarily conduct their own testing program and take appropriate action if necessary. In New York State, outlets in over 4,500 school buildings were tested for lead under this regulation. There are 5 main components to Subpart 67-4, the first being monitoring, which includes the requirements for sampling and testing. The second is response, which addresses the required response when there's an action level exceedance. The third is public notification requirements. And the fourth and fifth components are reporting and record keeping requirements. And I'll go into a little more detail on these 5 components now. So under monitoring, per the regulations, samples must be collected at all potable water outlets. A potable water outlet, as defined under 67-4, is an outlet that is used or could potentially be used for cooking and/or drinking. Such outlets included but aren't limited to water fountains and bubblers, classroom sinks, bathroom sinks, kitchen sinks, athletic field concession stands, etc. Basically, any outlet that is or could be used for cooking or consumption should be sampled. It was the school's responsibility to conduct a thorough evaluation of the school building's plumbing system and identify those outlets that need to be sampled in each building. To date, we have collected data from over 335,000 outlets across New York State. We did not require any special certification requirements for the sample collector. Anyone who is well-versed and competent in EPA's 3Ts sampling protocol can collect the samples. The sampler must be able to maintain QA/QC protocols for sampling to ensure sample integrity and that a chain of custody of the water sample is maintained. The sampler could be a custodial staff person, a health and safety staff person, or it could be a laboratory representative or a consultant. The school had the primary responsibility of ensuring that proper sample collection and implementation of the requirements of this regulation. The requirements for sample collection included samples must be first draw samples from a cold water outlet. The samples must be collected before any water is used throughout the building the morning of the sampling event. The water must have been motionless in the pipes for a minimum of 8 hours and no more than 18 hours prior to sample collection. The sample collection volume is 250 milliliters, and a wide mouth plastic bottle is recommended for collecting the sample. A 30-second flush or a second draw sample was not required. However, each school could choose to do so at their own discretion. All samples collected for compliance under subpart 67-4 must be analyzed by a laboratory that is approved to conduct lead testing in potable water and accredited by the New York State Department of Health's Environmental Laboratory Approval Program, also known as ELAP. The regulation has staggered or phased-in sampling compliance dates for completion of the initial sampling requirements. This was done to reduce the burden of sampling for the school districts, as well as laboratory capacity burdens. Buildings that house the lower grades, pre-K through 5th grade, had to be done first, followed by the higher grade schools, 6th through 12th. As you can see by these sampling compliance dates, there was not a lot of time for our schools to complete this task. The regulation took effect on September 6th, and all testing had to be done by October 31st last year. So basically, the schools had less than 2 months to complete their initial sampling requirements. With lead contamination issues dominating the news last year, especially due to Flint, Michigan troubles, there was a heightened awareness about health concerns related to lead in drinking water. Many schools had taken proactive actions to identify potential problems within their school districts prior to this regulation. So if a school had conducted a lead testing program prior to September 6, 2016, not all was lost. If a school conducted a program after January 1st of 2015, and it was conducted in a manner that was consistent with the requirements in subpart 67-4, that historical sampling event would satisfy the initial sampling requirement. So basically, any sampling that was done by a school 20 months prior to the regulation that was done in a manner consistent with the requirements, it would satisfy the sampling requirement. If a school conducted sampling prior to 2016, prior to September 6, 2016, and was not consistent with subpart 67, but was in substantial compliance with the regulation, the school could apply for a waiver from the initial testing requirements. Examples of substantial compliance variations that we would consider included things like the pre-stagnation time was a little longer than 18 hours, or the sample volume was less than 250 milliliters, things along those lines. The next sampling event is slated for 2020, and then subsequent sampling events will occur every 5 years thereafter. The 5-year monitoring cycle coincides with New York State Department of Education's Building Condition Survey schedule that schools must complete every 5 years, the next one being in 2020. However, in the regulation, there is a caveat that states continued monitoring can occur at earlier time intervals if deemed necessary, as determined by the Health Department's commissioner. The regulation has a provision in it for school buildings that were built with plumbing materials that meet the new lead-free definition as defined in amended Section 1417 of the Federal Safe Drinking Water Act. If a building was built after January 4th of 2014, then it was exempt from the initial sampling requirement. In addition, if a New York State professional engineer or architect certifies the building's plumbing to be lead-free, it too could be exempt from the sampling requirement. Go into some response aspects. The New York State school lead action level for drinking water under 67-4 is 15 micrograms per liter, or parts per billion. This differs from EPA's 3T's action level, which uses a 20 part per billion action level. The New York State action level is not a health-based number, as no amount of lead is considered safe. Rather, the 15 part per billion action level was chosen because it is consistent with the action level under the lead and copper rule, and it eliminates confusion between the lead and copper rule action level and the action level for 67-4. And while it's not specifically a health-based number, it is more protective than the 3T's guidance, and it's a good start moving in the right direction towards protecting public health. When a school receives their lab results and they find that the lead concentration at a drinking water outlet exceeds the action level, the school must do the following. It must prohibit the use of the outlet, that is, take it out of service or turn it off until a remediation plan is implemented to mitigate the lead level at the affected outlet. And then retesting results indicate the lead level is at or below 15 parts per billion. And they must also make sure that they are providing building occupants with an adequate supply of potable water for drinking and cooking in the interim. In addition, the school must notify the local health department of the action level exceedance as soon as possible within 1 business day after receiving the lab report. And then they must notify their school community, including staff, students, parents, and guardians, of the test results in writing within 10 business days of receiving the lab report. The goal of the reporting timelines was to make sure the schools are transparent and require that they inform the school community in a timely manner. A question that came up often was, if an outlet tested above the action level, can it still be used for cleaning and hand washing? And the answer is yes. This was important because we didn't want to remove one hazard and force another hazard, as hand washing is very important in preventing the spread of communicable disease. For those outlets where hand washing was important, signage could be placed near the outlet stating that the water should not be used for drinking and should only be used for hand washing and cleaning. If small children were using the water at these outlets, pictures should be incorporated in the signage, and staff should ensure that they understand what the signs mean and monitor these areas to ensure that they don't drink the water. The next few slides are just some examples of the signage that we developed for the schools to use. They are available on our website to download and print out for use. Our goal was to provide this resource to schools to remove the burden of individual schools having to create their own signs, but more importantly, we wanted to create standardized signage for schools to use that met the criteria of being easy to understand for all age groups and with clear messaging. We tried to develop signs to depict the various outlet uses in a school setting. And one more, as I said, they are available on our website to download and print out. The intent of public notification requirements is to ensure that schools are transparent and forthcoming to their school community on the status of the lead testing program in the school district. Schools are required to post on their school websites results of all lead testing performed and lead remediation plans is implemented as soon as practical, but within 6 weeks of receiving the lab reports. Now, if a school conducted testing and had implemented any of these remediation plans that were consistent with the requirements of 67-4 prior to the September 6, 2016, those plans also had to be, and results also had to be posted on the school's website. Schools were also required to post on their website a list of any buildings in which their internal plumbing of the school is deemed to be lead-free by the new federal definition. So this would likely be any newly constructed buildings. Now on to reporting. The legislation required schools to report their data electronically through the health department's designated statewide electronic reporting system, which didn't exist at the time, so this was a major challenge that we faced. We met with our IT folks very early in the process, and it was determined that there was not enough time or resources to develop a separate database and reporting system. So we opted to use an existing system in our health commerce system known as HERDS, or the Health Electronic Reporting Database System. This is the same reporting system that schools use to report immunization records to the state, so this seemed to be a feasible solution for reporting requirements. The reporting of lead testing results was done on a building basis and not on a school district basis. Therefore, if a school district had 10 buildings pre-K through 12th grade, then they would need to report their summary data for each of the 12 buildings. As soon as practical, but within 10 business days after a school receives their laboratory reports, the school must report summary data of their test results into HERDS, the statewide electronic reporting system. We tried to minimize the reporting burden on schools by collecting summary data in the electronic database, but still required the schools make the individual test results available to the public on their website or by request in person on site. It should be noted that hard copy results were not to be sent to the local health department nor the state health department unless specifically directed to do so. We only need and wanted the electronic data. The reporting requirements consist of 3 forms in HERDS. One form for listing the names of any lead-free buildings that the school may have. One form for sampling information, such as the number of samples collected and when they were collected, etc. And one form for results information, such as how many outlets exceeded the action level, were they taken out of service, etc. There were a total of 13 questions to be answered from the 3 forms. This is a screenshot of the sampling form that a school would fill out. This form has 7 questions. Answers are filled in the boxes denoted by the green dot. I know this is small to see, but this just gives you an idea of the simplicity of the summary reporting forms. At the end of each form, there's a box that the reporter must check, attesting that the information reported is accurate and true to the best of their knowledge. The data generated from this regulation is made available to the public in 2 forms, the first being on the school's websites. Each school is required to post all their data on their website. Second, all results reported into the HERDS database are available to the general public through the New York State Department of Health Data New York website. Health Data New York is a central repository for various health-related data sets. You can view all of New York State's school lead data by going to this website and type in school lead testing in the search box. This is a screenshot of the Health Data New York school lead data. Health Data New York uploads all the summary data and information that is reported through the HERDS database on a nightly basis. This interactive website allows you to sort the data by school district, school building name, county, etc. to customize your information requests. Talk about some record-keeping requirements. Schools are required to retain on-site records of test results, remediation plans, lead-free building determinations, and waiver requests and approvals for 10 years following the document creation. Copies of these documents had to be provided to the state health department, local health department, or state education upon request. A couple words about the waivers. As I mentioned earlier, there's a provision in the regulation for schools who may have performed sampling prior to September 6th regulation date that substantially, but not completely, complies with subpart 67-4. In these cases, schools can apply for a waiver from the initial sampling requirements. The school must demonstrate that they conducted the testing prior to the effective date and document how they substantially complied with the new regulation. And any needed remediation, included retesting, had been performed. And finally, that the lead concentrations of the potable water outlets is equal to or below the action level. We only had 2 waiver applications, and both were approved. Many schools had done testing prior to September 6th, but opted to do it again. Talk about remedial action plans. The burden of developing building-specific remediation action plans falls on the school officials and their consultants. Local health departments and the state health department were not responsible for reviewing or approving school remedial action plans. However, if the local health departments wanted to do so, they are able to do so at their discretion. When it came to remediation options, we deferred to EPA's 3Ts technical guidance for recommendations for routine, short-term, and long-term remediation or control measures to assist schools. We encourage schools to consult with a professional who is well-versed in remediation of lead and drinking water matters to determine the appropriate short and long-term remediation measures for a specific school and their outlets. Some acceptable short-term remedial measures included shutting off the outlet with the lead exceedance, providing an alternate source of water, and flushing the plumbing and outlets. A list of some of the accepted long-term remedial measures that we recognize included outlet or fixture replacement, permanently shutting off problem outlets, plumbing-related efforts such as checking grounding wires, lead pipe replacement, plumbing reconfiguration, and use of lead-free plumbing materials. In addition, providing an alternate source of water, including automatic flushing systems, as well as point-of-use treatment such as filters. Again, developing and appropriately implementing the remedial action plan is the responsibility of the school officials. Upon reasonable notice to the school, an employee of the department, state health department or the local health department may enter the building for the purpose of determining compliance with subpart 67-4. If a school does not comply with this subpart, the department may take any action authorized by law. We haven't conducted any enforcement actions, at least to date. Our efforts and goals have been mainly focused on working with the school districts to ensure that they are in compliance with the requirements. All of our efforts in developing and implementing our lead testing and school drinking water program have been compiled and can be found at this website. The right side of this slide is a screenshot of our website. The left side is a slide with just a little bit larger print version so you can read it easier. You can find the following information on our website. A 12-page frequently asked document which contains over 60 clarifying questions and answers that need to be addressed after the fact. Excuse me one moment. Detailed written and sampling instructions, a link to a 5-minute sampling video, link to ELAP, all the ELAP approved labs so that schools can easily find a lab to do their testing. Example signage for drinking fountains, bathroom sinks, etc. that could be downloaded and printed. Public notification language templates for letters. Step-by-step instructions and information on how to access the HERS reporting system and what need to be reported. All of our webinar recordings for the schools and local health departments. Links to letters and memos sent to schools and field offices, and links to other EPA New York State educational resources. Excuse me. From the end of August 2016 to the end of the year, basically 4 months, this timeline of activities conducted by the lead and school drinking, this is a timeline of activities conducted. It's small and a little fuzzy, but the intent of this slide is to show the thumbnail view of everything that occurred over a 4-month period after the regulation kicked in. The timeline includes all the outreach activities and information resources developed that we completed and was listed in the previous slide. It's a good visual of how busy we were during the implementation of this program. Right now, our current focus is on assisting schools to reach 100% testing and reporting compliance. We are also conducting data quality improvements as some of the information that the schools have reported needs some quality control review. We continue to answer remediation questions and provide guidance to schools on post-remediation reporting. And we are already planning ahead for the next sampling event in hopes of making it a better program in 2020. If your state is considering developing a similar regulation or program, here's some information for you to consider. Early on, clearly identify and define the intent of the regulation. For New York State, the intent of the law was to get the lead out by removing the sources of lead in drinking water to the best of our abilities. This message or intent guided our regulation development and implementation efforts. Another tidbit to contemplate early on is determine the purpose of your data collection efforts and if electronic reporting system can support that goal. Do you plan to use the data to establish a baseline of school drinking water lead levels, or do you want the reporting system to be a real-time snapshot of school lead levels in the drinking water, or a combination of both? Try to minimize the burdens placed on schools. They already have a lot on their plates in their day-to-day operations. The more guidance and information and resources you can provide them from the get-go for proper implementation of the requirements will greatly increase the level and integrity of the program and results. And of course, the incentive of funding or reimbursement of expenses will greatly increase school compliance. In addition to program resources, you will need various staff experts to address the various implementation aspects of this type of program. The obvious, you need technical staff and knowledge with drinking water program expertise to develop the program and address technical questions, including sampling protocols, engineering controls, and laboratory issues, just to name a few. Outreach specialists who fully understand the law and are able to respond to questions about implementation is invaluable because you will have lots of questions. To address the influx of clarifying questions that we were getting, we had to create a Q&A document that is posted on our website. It quickly grew to become 5 pages long with over 60 questions. You will also need IT staff to develop a reporting system, or IT staff who is familiar with an existing reporting system, who can troubleshoot problems, conduct account management tasks, and provide the technical expertise to do outreach with the data. And lastly, you should have legal counsel involved early on and available to assist with the legalities and the regulation development, as well as legal questions that will come up during implementation. Excuse me. Some questions that we struggled with and are worth pondering before you develop your own regulation or sampling program include pre-stagnation flushing. Should this occur prior to any sampling? And if so, what would your guidance be? Clearly define when and when not to conduct sampling events with respect to weekends, extended vacation times, etc., and how pre-stagnation flushing program would or should be co-implemented. Determine in advance if you will accept point-of-use filters as a long-term remedy. If you will accept them, be prepared to develop standard operating procedures or best management practice guidance documents for schools to use to ensure that this remedial measure doesn't create other drinking water related problems. That concludes our presentation today. Thank you for listening. We will be happy to take any questions you may have while we still have time today. You can also contact us through our lead in school drinking water email address listed here. If you have questions after this webinar, please feel to contact us through this address and we'll be happy to share information experiences with you. Thanks again for your time today, and now I'll hand the baton back over to Victoria.
Thank you so much, Kim, for that presentation. Before we jump into questions regarding your presentation, maybe I'll let you catch your breath, and there are a few questions regarding logistics in the presentation slide.